Welcome to episode 33 of Bonding and Beer. I'm your host, Rolando Nunez, and today's topic is a very interesting conversation with Dr. Devin McClintock. Let's go. So today, our topic is basically a conversation we're going to have with Dr. Devin McClintock. I met her in Charleston, South Carolina, through a C program that I lecture at. It's called Impress, run by Dr. Adamo Tarantonio and Amanda C., and that's how I met her. She was working there, and she has, become a key opinion leader for Bisco, and she's doing fantastic dentistry. She's pursuing AACD accreditation. She has an office in, I believe, is Virginia, and she's just a fantastic dentist, a fantastic human being. And what we want to get out of this this conversation that we're going to have with Dr. McClintock is just a few tips regarding her journey for to new dentists. And you might find it interesting to learn about her journey, and you might gather some information of value. I think everything that she's done has a tremendous amount of value, but her journey is quite interesting. So, to all new dentists that are, tuned in right now, pay attention, take notes. It's going to be a lot of fun. And of course, we're going to try some cool beer from Virginia. Let's go. All right, so here we have Dr. Devin McClintock, and I'm not saying this because she's here. She's one of my favorite people in the whole world, in the dental community. She's been nothing but just a joy to know. It's been a while since I got to meet her, and I've shared with her so much, but I'm going to let her do her own thing. And Dr. McClintock, Devin, tell us about yourself and how did you get into dentistry?
So, fun fact, my sister knocked out my front tooth when I was 18 months old.
Okay.
And not even just that, I still have the tooth. My mom held on to the tooth. It's literally in the cabinet back here. It's like in a Tupperware, like straight out of the 90s.
Tupperware.
Like,
you have your front tooth in a Tupperware in your cabinet.
I have my front tooth. My front baby tooth.
Okay, let me just for our audience, we haven't started drinking yet, so this is just a regular conversation Devin McClintock and I will have on a regular basis. Okay.
Yeah.
Okay.
Yeah.
So
casually have my front baby tooth, fully intact root and everything.
You were what? You were 4?
18 months. I was a year and a half. And like that tooth had just come in. Like that, like I had not had it very long. All I will say is I'm the youngest of 5. I grew up in the 90s. Like it was a different era. Kids were left to their own devices and weren't so heavily supervised. And
feral. They were feral. Yes.
Correct. And my sister, who was 3 years older than me, so 4.5, built a bridge that she was smart enough to not test herself, but to have me test it. And long story short, I got launched off of it, landed on a tape dispenser, and it ripped out my front tooth. Thankfully, I have no memory of this. My dad wanted to like shove the tooth back in. My mom called the dentist. He was like, for the love of God, please don't do that. So instead, I guess she apparently like held onto it in Tupperware, and she gave it back to me like 3 years ago. So I think I have to like encase it in like acrylic or something. Like I haven't figured out what to do with it. So it's still in the Tupperware circa like what, 1992, 1993. Yeah. Pristine condition. But needless to say, my introduction to dentistry happened very early on, thanks to having older siblings. She's the only reason I was like in the dental chair. I was a very low cavity risk child, but had a lot of time because she knocked out my front tooth. And then when we were like, I was 11 or 12, she broke my bottom tooth, like permanent teeth. Yeah.
So, all right.
Yeah.
So this family of yours is extremely questionable.
Correct. I still tell her she owes me 3 teeth. And that anytime she sits in my chair, that just know that at some point I'll come collecting. She likes to remind me I have a career now and that I should be grateful.
Because of all the aggravation and oh my God. Okay, that was a lot.
Yeah.
All right, before we move forward, we have to follow the rules that Jeremy, the producers, have provided to us. But what kind of beer do you like? And I understand you picked a beer, but what kind of beer do you like?
So in general, I would say I'm pretty girly with my beer. I like my citrusy beers. I like my wheat beers, pilsners, the lighter beers. I went to college in Boston, so I love a good Stamper, like those types of, like I said, girlier beers. Anything that you can put like an orange slice in, I love it. But I'm also like, I like the seasonals. I know this is going to break your heart, Rolando. I'm not an IPA person. I'm sorry. It's just too much flavor for me, I guess.
Well, okay. We're going to get into the beer. Let's go, Jeremy. She's showing the tooth. She's showing it. Oh, my God. That's a perfect central incisor.
Right? Look at that. The apex hasn't even fully formed.
Oh my God.
Could use a little polish, but
oh my. This beer that you choose is called Pumpkin Amber Ale Pumpkin Spice or something. And I can see this actually touches your whole I am going to Starbucks during the fall and get a pumpkin spice. Are you one of those people?
I'm not a coffee person.
Okay.
So I'm not. But I will say, like, I have had a pumpkin spice latte before, despite not being a coffee person, and it's pretty spot on delicious.
Yeah. I'm not going to lie. It is a very good coffee. Now, mind you, please show your growler. Yeah.
I didn't think one beer was enough.
Okay. So she's setting up a bar. Okay.
My team is a little worried about me getting home later, but it's fine.
It's fine. The beer name is Pumpkin Ale. It is done by Aleworks from Virginia Craft Beer. The style is spiced amber pumpkin ale. This is a 7.3. So the description
I did not realize that either. So now I'm really a little concerned about getting home.
Yes, there is a chance of us getting a little face over here, especially you with a growler. So the description directly from the website, as always. Powerful notes of cinnamon, nutmeg, brown sugar, and more from this world-famous beer, commonly described as a pumpkin pie in a glass. Now, you already said why you like this beer. I opened it. I missed the original crack over here. Jeremy, sorry about that. And I'm pouring it. And of course, I'm a professional when it comes to pouring the beer. And as you can see, there's a lot going on. I dropped my earbud, hit it back. I botched this one. To all the haters about my pours, you need to stop. So, yeah, this is not about me. It's all about her. So, let's give this one a sniff. Yes, smells definitely like cinnamon, nutmeg, and pumpkin. Let's try this one.
Sip, sip, sip. Sip, sip.
You know, Jeremy, I'm not going to lie. I have been against trying anything than an IPA. But every now and then, I am surprised. This, I will definitely have again. Definitely have again. This is a good one. This is a different one. Hey, y'all, if you have access to Ale Works, okay, this Virginia craft beer, this pumpkin ale, definitely give it a chance. Definitely. If you like pumpkin, this is going to hit the spot. If you like that pumpkin spice coffee from Starbucks, or pumpkin spice coffee, doesn't need to be from Starbucks, but if you like that kind of flavor profile, this does taste like a pumpkin pie. But we'll get into the beer review at the end of this here podcast. So let's get into it. Okay, so the topic of today's conversation with Devin is advice and tips for new dentists. And the reason why I want to do this is because we've had in this podcast as guests people that have gone through a career like Bradley Olson. All right, Bradley Olson is, I don't want to say at the end of his career, but he's definitely has had a long experience. And then we have like Adamo, who's like at his prime right now, right? At his prime, AACD member, AACD accredited fellow. Like he's had a trajectory, but right now he is at a very productive part, of his career. But I want to hear your take on this because you are pursuing in your own way a similar career, which is AACD accreditation and all this stuff, right? So what made you go that route, and what kind of, what have been the most, complicated points in getting to where you are and where you want to be?
Yeah, I mean, I think there's so much we could talk about, but I would say for me, obviously, personal experience kind of drove my pathway into dentistry. I mean, losing my front tooth at 18 months old, didn't get it back till I was 8. But personally, like I'm somebody who's benefited as a patient before I even knew better from responsible aesthetic dentistry, minimally invasive care. And I also know what it feels like to feel self-conscious about your smile. So for me, when I was in dental school, like I was always kind of interested in that cosmetic aspect. And I think it's so hard when you're in school, and even when you graduate, you're like have a fire hose of information being like guzzled down your throat. You're barely floating to stay like ahead of the water, just to stay afloat. But I always kind of had that desire for cosmetics, and it's not really something you can learn when you're in dental school. So for me, it was always really important to like invest in myself and kind of say the quiet thing out loud. Like, I like aesthetics. I want to learn how to do more of that. I mean, so many people are like, I want to be an orthodontist. I want to be an oral surgeon. I want to go into endo. And I was the person there being like, I want to do cosmetics. And unfortunately, you'll find a lot of people wanting to discourage you and stand in your way.
How so?
And I think, well, I feel like a lot of people don't see the value in it of, especially cosmetics. But I found, like, when I was doing my hospital training, I got told by attendings, yeah, we'll see how you feel about owning a practice when you start having kids. I mean, I bought my practice and had my daughter the same. Was it hard or was it easy? No. But do I regret either? No. I've been told that, patients it's like cosmetic cases are just a pain in the butt. They never turn out the way you want. Those patients are always the most demanding. And I don't know. It always stuck with me that I wanted to be able to deliver better. I wanted to be able to better assess my patients, diagnose my patients, and getting involved with organizations like the AACD. I had an opportunity to go when I was in my hospital residency, and I got told by my director that I was wasting my time and I should spend money on CE that actually has a financial yield. I remember when I went to my first Impress course with you, Rolando, when I met you as a student, and my boss at the time told me it was a waste of money learning that bonding was a myth. And that, if I wanted to spend money learning, that I should invest in implant CE and placing implants and doing traditional braces as a GP. And it's not trying to knock any of that, but
No. Let's celebrate her or him, whoever him or her was. Him. Let's celebrate him right now. And thanks to his discouraging advice, we are here today drinking a pumpkin ale from the distance. And I will never change that. Never. So thank you, sir. Not even going to call you a doctor. Go on.
Well, it's funny because I found that the more I gave in to like how I felt, like the things that I felt like I valued and I wanted to learn more about and do more about, I then found my people. Like I found my
you found your
people.
Niche. Yes, your tribe.
I found my tribe, and it was like I could say things like, I want to learn how to bond better. I want to know how to like make veneers last. And like, I want to know how to do these things. And those people would be like, yeah, let's do more. Like, let's sign up for this course. Let's do that course.
Isn't it crazy that when you find your people and it's just when you're surrounded by like-minded people, you're like, the first thing is, I'm not alone.
Yeah.
I'm not alone. And the other thing is, okay, I got all these people that are actually going to help me get to where I want to be. So that's awesome. So you didn't get any good advice, solid advice before graduating. What kind of advice do you wish you would have had?
I wish, and I say this to any dental student that I meet, I wish I had found organizations while I was still in dental school. I wish that I had taken the time to kind of lean into those topics that I was interested in earlier, because one of my biggest regrets was when I was a fourth year dental student, the AACD's annual session was in Toronto, which if anyone knows where Buffalo is compared to Toronto is actually the closest major city to Buffalo. Fun fact, it's in a different country. It was one of my fun things to talk about Buffalo, that the closest major city is in another country. But like I could have gone and just met these people earlier, listened to these people earlier, got inspired earlier, and kind of push my journey, forward. Not necessarily faster, but like I had gotten more reassurance that like those organizations, those peoples, and those mentors are out there. So I feel like it would have helped give me some of the confidence I wish I had, plus the resources they have for students. Most organizations have incredible resources for students.
Yes, they do. They do.
That are way better, no offense, than some of the resources we get in dental school.
Well,
I mean, we would like take amalgams.
I want to say this because there is always, sensitive people. I believe universities are supposed to provide you with their basic fundamentals for 100%. You to be able to go out there and practice solid dentistry to a certain standard. Okay? The standard that you want to elevate your practice is going to be totally depending on you. It's not going to depend on the university. The university gives you the tools and hey, go, you're licensed now, you're good to go. And technically you are trained in order to avoid harming anybody. Yeah. So, but, when it comes to this type of the thing with cosmetic dentistry, and I don't know if this is the way you feel, or even restorative dentistry, is that it's not a certified specialty by the ADA. You either are a prosthodontist or a GP. But there isn't that restorative, cosmetic, aesthetic dentistry program that is certified by the ADA. It's not a Correct. True specialty, but it is.
Well, I think it also has to do with, I think you're absolutely right about the dental school. The way I always use the analogy is they always say that like in medical school, they teach you enough so you don't kill anyone. Like in dental school, like they teach you enough so that you have the foundation, you're developing the technical skills and you're learning how to do the assessment, but they just don't have the time and resources to give you that all encompassing education that you really need to pursue. And I always tell students, I mean, I hate to tell you this because I remember what it was like to be in the thick of it, but like, the education doesn't stop when you get the diploma. That's the launch. That's the launch point. That's where you start.
That's where you start. Exactly. Now, and let's talk strictly about what you do. And I know you are fully focused on cosmetic, but you had to start somewhere. What do you feel or what do you think are the most important skills that you need to sharpen right away, right out of dental school, if you want to pursue something like what you're pursuing?
Diagnosis and treatment planning. I think one of the most overlooked things with cosmetics is you can do a beautiful case. I don't care who you are. You could be in dental school and do a beautiful case, but if you don't understand how the patient got to where they are, no matter what you do, it might not last. And I think one of the silent, I don't know how to describe it, but like the one of the biggest foundations is understanding what your obstacles are before you start. And I always joke, for me, having good mentors in my life means I'm trying not just to learn from my own mistakes, but learn from their mistakes.
For sure.
And also and that way I don't repeat those mistakes. But that way, again, everything is a learning opportunity. But if you don't have a solid understanding of the diagnosis and how the patient got to where they are, what type of wear they have on their teeth, was it something they broke? Did their sister knock their front teeth out? Or,
Okay.
Has it been happening for years? Are they like, is there something going on that's going to compromise the care you give them? It's all encompassing. And if you don't have that foundation as to why the patient got to the current situation they are, then you're never going to be able to really deliver sustainable aesthetics. So I think having a good foundation and understanding on how to really assess a patient is the key to any successful restorative practice, but especially cosmetics.
So if you take that in retrospect and think about, recently graduated Devin McClintock out of Buffalo. What were the mistakes that you made, and you became aware of those mistakes right away? Because whatever the reason, lack of experience, lack of knowledge, all of the above, whatever, what were those mistakes, and how could you avoid them?
Yeah, I mean, I would say my biggest mistake was not properly diagnosing my patients. I mean, like, I can't tell you how many night guards I delivered my first year as an associate, or crowns that I did that, looking back, kind of like I feel guilty about it. Okay. But it's also like the saving grace we have to give all ourselves is, until we know better, we can't deliver better. And it's hard sometimes to look back at some of the work that you do. And I mean, I think I learned a lot from Adamo that it's, not everybody has work they're proud of out there. And, the important thing is that we're always trying to be better every day and moving forward. And for me, I mean, I think one of the biggest lies between us that associates, especially younger doctors, are told when they join practices is that the lead dentist, the owner, whoever, is like, I don't care if you don't know how to do things now. I'll teach you. I'll train you. I'll take you under my wing. It never happens, Rolando.
That's not true.
It never happens.
I'm sorry.
And it's the biggest load of. Am I allowed to curse?
Yes.
The biggest load of that anyone, and that first boss that I told you about, who told me bonding was a myth, veneers don't work. All that stuff. He told me he would mentor me, and I'm like, I'm good. Like,
yeah.
But also,
when you get to that point, you're like, yeah,
happened.
I'm good. Yeah,
I'm good.
Well, I let me tell you a funny story. When I started working as an associate, I also made a bunch of mistakes in crowns and bridges and whatnot. And then I went to a course with Dr. Pete Dawson, right, on occlusion. And it was Pete Dawson and what was the other guy's name? John Graham in St. Petersburg, Florida. And I came back home after that week, and the first thing I did, I've never been very religious, but I went to church to ask for forgiveness for all the darnest things that I had done to my patients up to that point. It's like, it was wild. I felt like I needed to call these people and change their restorations, because I did not know what I was doing. I had no clue. I was so off. And you are correct. Nobody took me under his wing. Nobody showed me the ropes. I had to find somebody and ask, can you help me get better? And that will be, I want to say, a pro tip, and maybe you could agree. You are going to agree with me. You need to find a mentor. You need 100%. To find it. The mentor is not coming to you. You need to find it.
But I think it goes beyond it, Rolando, because it's not just that you need to find a mentor, but you need to make yourself someone worth mentoring, which is like the dichotomy of the relationship that I think, and that is what I always try to stress to new grads. Like, there's a book called Lean In, and one of the things that she talks about is that she's like a CEO, CFO or whatever, something at Facebook. She was high up in the C-level at Facebook. And she said she would go to conferences and like these random women would come up to her and be like, will you be my mentor? And she said it was kind of like the book, like, are you my mother? Like, will you be my mentor? And there's a difference of, it's not just about finding a mentor, but proof to that person that you are somebody worth mentoring, that you're not just going up to them and being like, hey, will you be my mentor? I need a mentor. Like, put yourself out there. Make sure that you're, doing the work on your end to make it worth their time to invest in you too. Because if you're not going to take the time to invest in yourself, they're not going to take the time to invest in you in a meaningful way. It's a relationship.
Yes, absolutely. It's a quid pro quo kind of thing. You need to show, you need to provide the value of being mentored. Mm-hmm. It's got to mean something to me to mentor you. Otherwise it's a waste of everybody's time. Now, I got another question for you. So, and I know you find this extremely important, but how would you describe to a new graduate the importance of continuing education from the get-go? Like, how long do they need to wait? Where do they need to look? Do they need to start failing before they start looking? Because that's what I did. I started looking for continuing education because I was having failures. So what would your tip be? Where do people look and that kind of thing?
I think it needs to start immediately. And that's why I was saying, like, I almost wish I had known about some of the resources that were available before even leaving dental school, just because I can be a little overly precocious sometimes. But what I would say for me, what never sat right with me, which never made sense with me, is like waiting for failures to then go back and fix. Like, for me, it was always about, this is the time in my life and in my career that is most critical, that's going to set me up for the rest of my career. And that might mean that it's a slower start to my career than maybe some of the people I graduated with. It's not that my path was right and theirs was wrong or vice versa. It's just about what makes sense for you. But for me, I wanted to minimize how many times I failed. But I mean, I still fail. Like, everyone still fails. And I think it's important to acknowledge that, nobody's perfect. But now I'm in a much better place where if I have a concern with a patient or a case, like, all I have to do is pick up the phone, text some photos, some sense, and I can sit down with a mentor from Vegas to New York to Washington. Like, you have people all over who are in your corner to help you, develop and grow. And to me, that's one of the most invaluable resources you can have. So even if you don't know everything, if you have that network of mentors that you can lean on, if you haven't seen it, they have. And if they, if you don't see it, they do. And not only do they like help me try to push me to not just get the answers, but to develop the answers, they help me fine tune my creative, assessment and my skills with any case that we work up together. And I just think the earlier you get to that, the more beneficial it's going to be for you and for your patients. And honestly, the more rewarding your career. I mean, I had a patient a couple of weeks ago, we're now setting up for orthodontic surgery. She came in for a cosmetic consult.
That's crazy.
But the first moment I saw her photos, I was like, this is not just a crown lengthening and veneer case. Like, this is not that case. So having that ability in my back pocket to be able to now just like look at a patient and realize, okay, this is going to be a longer conversation. This is not a simple conversation. But I had that background to at least be able to identify and build my team of specialists to work with. So now this patient's being worked up for orthodontic surgery and she came in for a gummy smile. It's wild to see like how you develop as a clinician, like, and a diagnostician, if you will, like in a matter of years.
It's, you talk about network. It's so great. And don't get me wrong. I am totally okay with answering questions from people. However, not everybody that asks a question will get the same answer. And one of the things Adamo and Amanda asked me to do is like, hey, you're going to be part of this group every time I attend to one of the courses. And these people, to some extent, are going to be counting on you to ask questions regarding bonding. I'm like, of course. Of course. Of course. So if they have a question, so I give them my number, you can text me, you can email me, whatever, because it's a learning experience. And sometimes I've had to say, hey, I'm not sure. Just, let me circle back to that in a moment. Let me just figure it out. And then I'll provide you with a better answer. So it's a growth opportunity for everybody. So I do appreciate the networking possibilities of continuing education. I have another question for you. I know you own your office, your practice. Now, what are the few first steps that people may have to consider regarding practice ownership?
Yeah. I will say I was very fortunate. I'm going to look back and say fortunate. I was actually working on another practice and was set to purchase that practice, and it all fell apart horribly. As I was informed later by a good friend that nobody ends up buying the first practice that they put an offer in on. But at that practice, I was the only working doctor. So the owner was on medical leave. So I kind of taught myself a lot on how to read financials and understand kind of how practices are run. I mean, again, dental school, fire hose, like you only have so much time and available brain capacity for knowledge. But one of the things they never teach us is how to be a small business owner, how to understand how practices run. Thankfully, there's lots of different consulting group options, but I have found personally, just learning how things work behind the scenes, like understanding, where the payments come from, what goes where, what the costs of things are, not letting it kind of be this kind of, as an associate, if you have a owner who's open and willing to kind of talk to you about those things, it's invaluable to see. I will say also visiting practices that are highly functioning. Let's just say the first office I worked at was not very high function. And thankfully spending 2 years with Adamo at his office is a larger practice, but very high functioning, very high quality, well run, well managed. And I learned so much just by being around that. And I always tell people, if you have an office like that that's nearby, or you have a mentor like that who's willing to let you come to their practice just to shadow, just to, be a fly in the wall, see how they handle situations and different cases, or how patients come into the practice, how they work them through the practice, how they do their workups. Like that is one of the most invaluable learning opportunities in terms of if you're thinking about going down that ownership path, because you need to have an idea how you want to run a practice.
But let's be clear. Adamo's practice is basically protected by the mafia. So nothing is ever going to go bad. You don't
talk about it, Rolando.
No, you don't. You don't talk about the bodies. You don't tell how many bodies. And when you say, oh, the murder, what murder? You know what I'm saying? So it's all good. Adamo, it's all love. Listen, Dr. McClintock, Devin, it's been great. I think we have covered a bunch of, interesting topics. And I hope that someone who is looking into, honing their skills, working as an associate, but not forever, looking into purchasing their first practice, and most important, creating a true network that will help them develop and get their practice to the next level, it's extremely important. And you've touched in all of those. I want to thank you for that. But we're not going anywhere. We're going to do the beer review. So let's freaking go. Dr. McClintock, give us your opinion on this beer.
So, fun fact, this brewery, Aleworks, is about a mile down the road from my practice.
Goddamn.
So,
being Devin
amazing.
McClintock is absolutely outstanding.
I also learned that apparently it's half price growler refills on Mondays, so that's going to be my new Monday activity. But it's funnier because I've had a lot of their beers before. I don't think I've had their pumpkin before. So this was a new, but I was excited. And then when I was telling people that I chose the pumpkin, I started getting all these messages from my team, patients, like who were like, "Oh my God, that's the best pumpkin beer. It's like my top 3 of all pumpkin beers." And I'm like, "Well, good. I guess I picked a good one."
Yes.
I very much like it. It's pumpkiny, but I'm also somebody who, it sounds weird, but I don't like too pumpkiny. And I think it's a very smooth, like I very much enjoy this, but it also definitely does not taste like it's 7.3%, which is probably
that's
why I won't make it home easily today.
Yeah, things don't taste like they're 7.3%. You just feel it when it kicks you in the... Now, I'm going to give here my score. Not my score, my review. I think this is a great beer. I think it's a beer that you can, regardless of the season, this is a nice, well-balanced, spicy, and by spicy, I don't mean hot spicy. I mean filled with spice flavor like cinnamon, nutmeg, and of course you got the pumpkin. It's balanced. It's not overwhelming. In any other flavors, it's not overwhelming. So I think this is very, very nice. I'm gonna let you give a score from 0 to 5, and you can do decimals, whatever. What do you give this one?
I don't know. I think I give it like a 4.8. I think you're right.
Oh
it's
my
like
God. She gave it a 4.8. Okay. She is extremely amateur. She don't know what she's talking about. But that's okay. That's okay.
That's right.
Yeah, that's right.
Listen, it's like a fall. It can be like Halloween, Thanksgiving. Honestly, you could probably do Christmas, like with the different spices, like you were saying.
Yeah.
Or like winter. I don't think I would drink it in summer or spring. It's too spice for that.
This is something I will definitely avoid during the hot weather, but during interesting weather, cold weather, something that
this is what I drink when I'm dressed in like my Han Solo outfit, like the ski jeans with the high riding boots and like like a sweater with like the Patagonia puffy vest or something with it. You know what I'm talking about? The Han Solo look. Going apple picking, pumpkin picking.
In a Han Solo suit, you're going apple picking? Okay.
Listen, as soon as somebody pointed out that like my whole like college like attire looks like girls in fall look like Han Solo, I was like, yep, that sounds about right. So it's my Han Solo fall look.
I'm going to give this one a 4.1. What does 4.1 mean? Anything above 4, you need to try. Anything above 4, you need to try. Anything above 3 is a meh. Anything below 3, you should avoid. Anything below 2, you should just consider garbage. So this is a 4.1, solid. We need to try this. Listen, we're going to our Q&A session, and we do have some questions for Dr. McClintock. Let's freaking go. All right, Devin, here's your Q&A. Now, question number 1. What's one piece of bad advice you often hear new dentists will get?
Oh, bad advice. Honestly,
don't believe in bonding.
Yeah. Oh, well, that was bad advice I got. Bonding was a myth, but yeah, that veneers don't work. Honestly, with today, like I feel like there's so much information out there. And it's great. There's a lot of really good information, but I feel like a lot of times new doctors have a hard time navigating what CE is. It sounds terrible saying it this way, so excuse me if I have anyone. But there's CE that's worth the investment, and there's CE that might not be, based off of where you are in your path. And I think that everyone has a curriculum at this point, I feel like, but I feel like there's very few curriculums that are critical for, like, we all have a finite number of resources. Like, we have a finite amount of weekends we can spend away from our family and friends and our work, and a finite number of dollars we can spend in CE. I always encourage people to invest in themselves first and foremost. Like, invest in yourself, believe in yourself, invest in your own education, but make sure you're investing in education that is actually going to be meaningful for how you practice Monday versus, big picture. Now, if you've already had that kind of foundational knowledge, that's one thing, but don't pick like the cheap CE just because it's there. Like, make sure you're intentional about what education you're investing your time and your money and your resources into.
There's a lot to take from that answer. A lot. And it's a very good, it's a very, very good answer. Right. Question number 2. What was your best investment early in your career?
Oh, easy. Going to AACD, my first conference. I met Courtney Levine, who introduced me to Sal Letardo and Adamo, who then I ended up doing the residency with Adamo, and now I know Rolando, and now my life is complete. So investing in my first CE course as a big girl outside of dental school, like, completely changed the whole trajectory of my life. So easy.
Amanda C.
Yeah. Oh.
When you look at the word bougie on Wikipedia, her face pops up. All right. So one last question, Devin. This is an interesting one. What clinical skill made you sweat the most as a newly grad?
What clinical skill made me sweat most? I mean, it still makes me sweat anytime I do a composite veneer on an anterior tooth. It's still like, or prep like a big case. Like, I'm slow. Like, Adamo is lightning. I'm like slow Sally. I talk fast. I talk a lot, but I work slow. And so it's like always like I'm sweating. Like, I'm glad my heart rate doesn't show to my patients half the time, but like, I take everything so sincerely. Like, I can be so empathetic where, like, I just genuinely always want to do the best possible work for my patients as if it was me in the chair. And so I just internalize all of it. And like, anytime I'm doing anything cosmetic or irreversible, I'm like, everything's got to go perfectly. I got to figure out how to do it. And it's hilarious because Adamo, like, I would freak out. Like, I remember one of my big first veneer cases, like, 8 was a little bit longer than 9. I freaked out, Rolando. And like, Adamo comes in and he's like, let me just adjust that. And then it looked perfect. And like, meanwhile, I'm like sweating bullets. Like, oh my God, I'm a failure. I can't do this. I'm the worst. And he just
You're
like,
not
comes
the
in
worst.
And it's just like,
nah.
just a little adjustment. And it's like, oh, okay.
And you're done. Next.
Yeah.
Absolutely.
Yeah, literally.
Absolutely. Listen, Devin, I want to thank you for coming to this podcast today. I want to thank you for the beer recommendation. I want to thank you for being so responsive to Jeremy, the producer, who's in charge of everything that's going on today. Now, to our followers and listeners and subscribers, remember, you can follow us on Instagram, Bonding and Beer. You can follow us on YouTube, Bonding and Beer. You can ask a question on Instagram. You can ask a question on YouTube. You can contact us via email, bondingandbeer@gmail.com. There is a link to our landing page, our Bonding and Beer page, on the descriptor of every single one of our YouTube videos. Now, I'm going to ask you to start following Dr. Devin McClintock. Show her some love. Where can they find you, Devin?
So I have 2 Instagrams. I have my personal one that's more focused for like dentists. It's McClintock DDS, I think. Yes, McClintock DDS Instagram. And then I have my practice, which is Precision Dentistry _ because somebody took Precision Dentistry. But that's more if you want to see kind of how I organize my social media. I think it's fascinating to see how everybody does their social media differently. So the more you look and see what you like or don't like from other people's, the better. So I encourage anyone to check out. You might like it, you might hate it, but highly recommend.
Listen, again, thank you so much. Jeremy, the producer, you did a fantastic job once again. And this is Bonding and Beer. Remember, follow, subscribe. Let's freaking go. Come on. We're going to have to do it again. Jeremy, the producer, realized that he hadn't plugged in the microphone, so we're going to have to run this again.